So next up is a fascinating man who I had the pleasure to talk to the other evening. It is Ambassador Jonathan Addleton. He has been representative, you'll read in the books, but he's worked in Mongolia and Afghanistan, and if you get the chance, I would take the opportunity to go up and speak to him in the session, in the breaks. But we're incredibly proud to have him here today. He's the Mission Director for USAID for India, which is a phenomenal partner to DASRA. They've been hugely supportive to the work we do with the Girls Alliance. We're incredibly proud to have him here today, and I will pass you over to him, Ambassador Jonathan Addleton, to deliver his keynote.
Thank you very much. Good morning. Namaste. Thank you for inviting me to speak here today, and thanks also to DASRA Philanthropy Week for providing this platform for so many people to get together to talk about these important issues. And of course, thank you for the DASRA team that has made this whole day possible. We've been talking about innovations and partnerships for the last few days now, and we've heard about innovative ideas that we hope will improve the lives of both adults and children in India. USAID is also committed to these goals, although it is doing it in ways that are very different than you might have imagined, the way that we worked 2 or 3 decades ago. India has changed, the US has changed, the world has changed, and USAID has also changed, perhaps in surprising ways over the past few years. Might add, I think that the support for DASRA is one example of that kind of change, because perhaps 10 or 20 years ago that wouldn't have happened. Of course, we are still working in some of the same sectors as before, including health, water and sanitation, renewable energy, education, financial inclusion, agriculture, and other areas. But we are doing it in different ways, including a much bigger focus on partnership, on innovation, on local institutions, and on private sector engagement. And we are doing it in ways that help that help try to share some of India's developed experiences more broadly, including most particularly in Africa and also in neighboring Afghanistan. It is, in that sense, our program is partly about India and the United States, but is also very much about India, the United States, and the rest of the world. I think that's also one of the ways that we've changed. And my colleagues, I say it so often, I know they've heard it many times, but basically my view is that when India and the United States are in a good place, the world is also in a better place. Most of my remarks are going to focus actually on health, and I say that because well over half our program is in the health field, and some interesting things are happening there. These are problems that require government, but they also require international donors, and I think especially these days they require private sector approaches. You all know the figures better than I do, and I won't rhyme them all off, but of course, according to the World Bank, you have 1 in 5 Indians living in extreme poverty, earning less than $1.90 a day. And on the health front, you have those 21% of the world's disease burden involves India, including 25%, 1 in 4 of the world's TB cases, and 20% of the child mortality cases. India also has the 3rd largest population of people living with HIV/AIDS. In response to these concerns, aid has shifted its approach and does include partnerships of many kinds, including, like I said, the government, the private sector, research institutions, and many other partners as well. I'm going to give 2 or 3 examples of this kind of work that we do. One is an example of a partnership that seeks to do this in the reproductive, maternal, newborn child, and adolescent health area. This is the RMNCH Alliance. It involves a number of partners here, including, of course, USAID, Kiwai Trust, Paramount Foundation, and DASRA. This partnership seeks to demonstrate high-impact, innovative approaches to improve health outcomes for mother and children, and to also empower adolescent girls. There's a long list of others that support this effort, including a number, I think, that are here today, and I'll just list some of them: DSB, BlackRock, Bank of America, Merrill Lynch, Philips India, Tata, Johnson & Johnson, GlaxoSmith, Azim Premji Philanthropic Initiative, Hindustan Times, Mint Publications, and of course the DASRA Giving Circle. Some of these other kinds of partnerships were also brought home to me even in the couple days I've been in Mumbai here. A couple days ago I signed the loan guarantee agreement with RBL Bank that basically will help the Health Spring group to expand its network of health centers from 30 to 300, a tenfold increase. And then just yesterday, I visited the Swastik Health Center in Dadhavi, one of the areas of Mumbai. This particular program involves USAID and also Tata, and in this case, it lets this network expand from 17 to 50. Of course, for all of us, when you get out there and see something that's especially more graphic, this is actually a health initiative that's sustainable and offers the initial consultation for 10 rupees and a root canal for 1,000 rupees. So I don't know how many of you have paid for root canals in other places, but it's a lot more than 1,000 rupees. We will also soon be awarding a 2.5 million public-private sector partnership to the Wadani Initiative for Sustainable Healthcare. This is the Wish Foundation, and basically the intent is to scale innovations that reduce preventable infant and maternal deaths in partnership with state governments, in this case in Rajasthan, Madhya Pradesh, and Odisha. It's a 5-year project, and it will support innovative healthcare solutions such as easy-to-use point-of-care diagnostics, model health ATMs that dispense drugs and medicines, and e-health centers. This is a very ambitious project. It's talking about reaching as many as 10 million people, but of course the demographics in India are so huge that 10 million is 10 million, bigger than most countries, but in India it's relatively small even then, but it is an example of scaling up. I guess from our perspective, of course, these are just examples, but many other examples are represented in this room, and I think it's the sum total of these that really can make a difference, especially in terms of offering innovative, creative, and even catalytic interventions. Looking ahead, and for the last half, I guess, of my remarks is I can't help but also look back at a case study, if you will, of how some of these things have happened elsewhere. And the example I'm going to cite is actually polio. I'm old enough, probably one of the older people in this room, but I'm old enough to have had classmates growing up that had polio. I think many people know the story. Even our president in the years before, Franklin Roosevelt, spent his life in a wheelchair because of that. He actually, this was before my time, but he actually visited often a place near where my parents were from originally. It was Warm Springs, Georgia. And of course, it was for those warm springs that he was there. But I think it completely altered his life, the fact it was young and old, rich and poor, that shared a common fate, in this case, a disability. And the fact is, by the early 1950s, in 1952, the 5 years before I was born, the worst year for polio in the US, you had 58,000 cases of polio. The fact is, at that time, in that era, it was the March of Dimes that had a huge private philanthropic effort to deal with it. And of course, in 1955, Jonas Salk developed the polio vaccine, and Albert Sabin developed the oral polio vaccine, making it cheap and easily administered, and that's had a huge difference. By 1962, the number of reported cases dropped sharply to 910, and in 1979, the US recorded its last case. In my notes here for these remarks, I have an example from Kandahar, where I did spend a year, and as people may know, Afghanistan and Pakistan are two places where polio still survives after all these years. Having just seen the film on Malala too, I can't help but think that people don't realize that Malala was actually named after a young Afghan girl called Malala, who was a hero of Afghanistan, and you have health centers and schools all over southern Afghanistan named Malala, not for Malala of Swat, but actually for the 19th century Malala, who her father intentionally named her after and said he wanted her to be as brave and courageous as Malala of Kandahar. So that's part of the story. But the other part of the story is I was in Kandahar and I got a note, completely unexpected. It was from America, and it was an 89-year-old woman called Ruby McBee. Her husband had been an agricultural scientist in Kandahar, and they lost their daughter in about 1955, the year that the polio vaccine came in. They were just too late. Marilyn McBee was 10 years old. She shared photographs from her daughter from that time, and rather plaintively asked, is her grave still there in Kandahar? And of course, that's a tall order in Kandahar given the circumstances, but we did track it down and sent her photographs. And I use that as an example of a lot of things, including, of course, polio, including shared sacrifice. And I guess the little footnote to the story is actually I was driving off through Kansas a few months later and going through Salina, Kansas, and that was where I knew that Ruby McBee lived at 89 in a retirement home, and I dropped by and visited her, and shared the experience, that common experience in Kandahar, and of course the fact that all these years later, it's the last little place where it still survives and hopefully will be wiped out. Again, the story of what happened there is interesting. The story that what happened in India is also interesting. But 3 quick lessons learned from that. One is the partnership was there. That was important. The initiative was strongly led by the government, but had a lot of private sector support. Second, of course, it was flexible. They had to make changes along the way, and I think that's a lesson for all of us. And third is simply the innovation in terms of messaging techniques. One of the spokespeople there was actually Amitabh Bachchan, who was the spokesperson for polio, and now in fact one of our activities is a spokesperson on TB as well. It really makes a difference when someone like Amitabh Bachchan gets up and says, "I too had TB." And I think in terms of outreach, that's all important. Basically, looking forward to working together, but also looking forward to the kinds of programs that people will still talk about 50 years later. And I do think that's possible here. My time is just about up, but I have my improvised notes at the very end said, "Do aur baatein hain, ek mahavar aur ek kahani." The mahavar is this, and people have heard it. I told my colleagues I wouldn't say it again, but I've heard partnership mentioned so often, so I will say it because it's everybody, even the Americans here and the other countries, can remember it from the UK and elsewhere, ek aur ek yara. And to me, it's such a powerful expression because it's basically 1 + 1 does not equal 2, it equals 11. And I think that's what all these partnerships about. The other one I'm more reluctant, but I'll just take 2 minutes. मेरे बचपन में मैंने शिकारपुर रहा. शायद आपको मालूम है शिकारपुर सिंध में अभी मुंबई से बहुत दूर नहीं. शायद शिकारपुरी लोग इस audience में हैं? No? Anyway, I spent, through an accident of history, I spent part of my childhood in Shikarpur. And the very remarkable thing about this, I think this is actually typical across India as well. And by the way, Shikarpur had historic links with Mumbai that I think were unfortunately broken. But the fact of the matter is, driving as a kid through the streets of Shikarpur on my bicycle, I saw around me all the time evidence of amazing philanthropy. The park was named for the person, the civil hospital, the schools. And again, talking about legacies, even though political circumstances changed, even though national boundaries changed, the fact of the matter, some of these people in Shikarpur, many of them, of course, had to leave at 47, are located all over the world, and in Hong Kong, in Australia, in India, of course, as well, in Mumbai, too. They left a legacy, and that legacy still continues. And again, the giving circle, the kind of people that are here today, the spirit that is here today, is actually embedded in India, embedded many, many years ago, and I saw it as a kid, and it's really gratifying to be here as well as today. So thank you very much. Dhanyavad.